I'm Dr. Heron Grant. I'm one of the medical officers here in the St. Catherine Health Department.
All right, so Dr. Grant, can you tell us what the HIV virus is?
So the HIV is a virus. It is the human immunodeficiency virus. What does that mean? As the name probably suggests, it causes deficiency in the immune system. Literally, it will wear the immune system down until it's non-existent, and that's where AIDS comes in. But I guess that's another question.
Right. So tell us a little bit about the AIDS, where it developed into AIDS.
All right. So somebody can live with the virus for many years, right? Which is why prevention and protection is so important, because you won't know just by looking. The prettiest and most good-looking of people can have the virus. So after many years, usually maybe after, depending on your immune system, some people will deteriorate faster than some, but you can live up to 7 years symptom-free, nothing happening, looking normal and everything going as usual, until eventually, as I mentioned before, the virus would have multiplied so much in the body, and it would have destroyed a type of cell, which is the white blood cell. The white blood cells are responsible for fighting disease and also for preventing disease. So you can imagine if somebody has no white blood cells, then they are basically left wide open to every and anything that can come along. So that's where the person is now considered to have AIDS, because they would have now acquired the syndrome where their immune system has been weighed down to the point where they can't fight off any illness, they can't prevent any illness. So that's where the danger and that's where death comes along.
All right, so say you have sexual intercourse, what's the window for you to go and get tested to find out if you're positive or not?
Usually when someone is tested, they are asked to return within 3 months to confirm whether that first test was negative. Usually if you're positive, then that's taken as is. If you're negative, however, then you're asked to return within 3 months, because the window period is 3 months.
Right.
So you could have picked up a virus, tested very early, and it doesn't show on the test because it's very early within that 3-month period.
Right.
So usually within 3 months, if it is there, it would show up. I mean, the tests nowadays are more modern and more advanced. They're able to pick up the virus a lot earlier, but usually an average of 3 months is given to confirm whether or not someone is actually negative, meaning that they don't have the virus.
All right, so after a person is diagnosed with HIV, does that mean that this is a death sentence for the person?
Interestingly, once upon a time that was deemed or considered to be so. However, with treatment, one can live a normal, healthy life for many, many years, even have children. So it is not a death sentence. The key is early detection and starting treatment right away.
All right, so how early after testing would you recommend that the person start treatment, and is treatment readily accessible?
Right away. As a matter of fact, the health department now promotes what is called test and start. So once you're tested positive, it is recommended, not that you're forced to, I mean it's an informed decision, but it is recommended that you start treatment right away. And yes, treatment is readily available. It is free of cost. It is provided by the Ministry of Health in all the Ministry of Health pharmacies. DrugServe, as the common name is. It is available in all hospital and health center pharmacies. It is also available in certain private pharmacies who are in partnership with the Ministry of Health. So right across the island, anyone, no matter what your bank account is like, it is available to everyone.
All right, so this is the St. Catherine Health Department. Where are some of the locations that you can go and get tested right away?
Well, you can get tested at any health center, actually. So any health center within the parish of St. Catherine, you can walk in and ask for a test to be done.
And when you come in, do you have to make an appointment, or you just walk in and you have a test done on spot?
Well, I know there are particular days at some of the clinics. I mean, a patient or an interested person would have to just go and find out. can't say for sure what the days are, but it is readily available Monday to Friday. You just have to find out which days are the days that they offer these tests.
Alright, so I know that you guys normally have persons that go out in the community. Is that a day-to-day basis, or are
Every
they
day.
set at specific locations?
They're
that
on
you
the
can...
road every day. Every day. Monday
Okay.
to Friday. Not sure about the weekends, but I know they're on the road Monday to Friday.
Alright, so also there's a lot of youth here today. What advice would you give parents at home watching to help to guide their children when it comes on to abstaining from sex and preventing the HIV virus?
Well, we're living in a modern age, and all these children have smartphones. Their phones probably even more expensive than mine are, and mine is. So it's not that we can keep them in a bubble and have them isolated from what really is going on. The important thing is to have the conversation. Have the conversation. Talk to your child, your teen, your youth about sex. Stress the importance of safe sex. Using a condom. The safest sex is abstaining until you would have found that one faithful partner who you would have been tested with, and both of you are negative. That's where the safe sex is. One faithful partner who has been tested just as you have, and both have been found to be negative. But until then, use a condom if you must. And I would say to the parents, have that conversation with your child, your teen, your youth. If they're not having it with you, trust me, they're having it with somebody else out there.
Alright, so my final question for you is, alright, so we just did the parents. What about the youth that are out there that might be curious? Their parents might not tell them about HIV or other STIs. What advice would you give those kids?
So we provide what's called an adolescent clinic. So the various health centers within the parish, there is a clinic that's open. If you have questions, if you are concerned, if you are curious, then come and get guided advice to help you to make wise, guided, informed decisions, right? On the phone as well. I mean, instead of watching stuff that's going to influence you to make the wrong decision, then seek out the sites where information is given. Remember, a channel like this, will give information to help to lead and to guide youth in the right direction.
Alright, Dr. Grant, thank you so much.
You're welcome.